Hello, everybody. Today, I want to talk to you a little bit about funding sources for people with intellectual and developmental disabilities, because I think it's very confusing to people to understand how to get the services that they need. And my reference today is the IDD Gateway Resource Guide, which you can all go to by typing in IDD Gateway Resource Guide, and it'll direct you to this page. It's sort of a one-stop information referral resource in the St. Louis area, and it's updated regularly because it's on a very easy format. So you'll be able to find most of the things that you need here. But we're going to deep dive today on the tab that says funding systems. And in particular, your choices are government agency or regional resources. So I really wanted to talk about that to start off with, that there are so many different mechanisms to get services funded, and they all come with eligibility requirements, and they all come with certain barriers to using them, maybe opportunities to using them. So I want to talk a little bit about funding from the local, regional, and state level, and then federal funding, kind of how that applies from a state level. So in the county you live in, you may have access to funding because you live in a county that has personal property taxes, and a portion of those taxes are designated for people with disabilities. You look on your personal property tax bill, it will either say developmental disabilities or it will say sheltered workshop tax. And it's about 3% of your tax money goes to these services. Those funds are delivered through a board that's run by each individual county, and the county has board officers as well as staff that receive the funds from the state and then deliver the funds based on the guidelines that each of these counties have established for services. So if you live in St. Louis City, you may have access to different services than St. Louis County or St. Charles County. So I think that's really important for people to know. I think it's also important to know that each of those areas have kind of different priorities. In some counties, they're funding a lot of services that are very family supports driven. In some counties, they're serving a lot of people that just need very limited support so that they can kind of tap that group that maybe aren't eligible for statewide funding. So as you can see with all these logos here, there are many, many ways to seek out funding. So DD Resources is the St. Louis City Office for Developmental Disability Resources. The Productive Living Board is our St. Louis County manager of funds from the taxes. DDRB is in St. Charles County, and Developmental Disability Advocates is in Jefferson County. And I believe that over 40 of the 51 counties in Missouri have this type of funding. So it's pretty universal. I will also say that depending upon what's available in your individual county, there's a lot of other funding sources that may be tapped into to provide resources, such as a children's mental health fund often can help us pay for services for both respite, counseling, and other kinds of ancillary supports. Being able to utilize United Way funding gives us access for services. And sometimes those services are designated by the funder, and sometimes they're open-ended. For example, the United Way has a safety net funding level, and when you receive that, you're able to kind of identify within your own organization how to best deploy the funds within parameters to meet the needs of your stakeholders. So lots of different ways that locally and at a regional level that you can get access to funding. Often these also have less rigidity about going through a process to determine disability eligibility, so they can be a faster way for you to get connected through the system, although not always. For example, in St. Charles County, you have to have an open case record with the state of Missouri to be able to access those services. So again, I've mentioned this before, but this is why it's important to have a relationship with an organization that provides family support supports so that we can help you navigate and figure out what to do when you are in need of a service. So sometimes we can help you tap things within your own insurance. So we're trying to be really creative and thinking about all the different ways that needs can be met. So we've talked about the regional resources. I'm going to click on the link for government agencies. And these are your agencies that are funded at a federal or state level to deliver resources. So I want to kind of walk through from the bottom. Supplemental nutrition, SNAP, is for people that financially are eligible. We have a lot of people that, because of their need for other benefits, are with below the poverty line or meet the criteria for SNAP. So we like to help people make sure they're accessing those benefits. Social Security benefits come in many different forms. So making sure that if you are eligible for Social Security, that not only you understand how to apply in a way that you're most likely to be approved, but also to understand the parameters around kind of what you need to do if you want to tap into Social Security funds. For example, you would need to have a capped amount of income, and making sure that we supported you or that you had everything you need to provide documentation to the Social Security office to manage your finances would be important for us to make sure that you felt like you were supported there. Medicaid and Medicare are your insurance systems. So if people have a disability, often they qualify for Medicaid or Medicare or both. You can have both. So applying for those, you would need some documentation about diagnosis and some other kinds of information. But that's a really important way to get connected into the system and make sure that insurance needs are met for somebody that maybe is going to be employed in a job that doesn't offer insurance benefits. Vocational Rehabilitation is the federal organization that manages employment supports for people that maybe are a little bit disenfranchised in the employment industry. So Voc Rehab can work with a wide range of people. In our case, they are providing supports for people with a variety of disabilities, and that support can range in many ways what they pay for, including paying for ancillary supports like education, like transportation to work, those kinds of things. So Voc Rehab is managed in the state of Missouri under the Department of Elementary and Secondary Education. And the Department of Mental Health is our umbrella organization that provides supports to people with developmental disabilities, mental health, and substance abuse issues. So one department for our state covers those three individual pots in three different divisions. And I want to talk about how the Department of Mental Health operates so that people understand what you need to do to be able to access actual dollars from the Department of Mental Health. So it's very easy to apply to get case management services from the Department of Mental Health. They've got a pretty straightforward process where you submit information about the individual with the disability. They have an intake department that will do research to gather IEP documentation or medical documentation, whatever they need to deem them eligible. But eligibility for case management is predicated on having Medicaid. Medicaid is what pays for your case management dollars or fund services. So if you are eligible for the Department of Mental Health, but you do not have Medicaid, you would be put on a list and receive information specialist support. So in the state of Missouri, there are 5 information specialists that are available to help you sort through any issues that you might have and brainstorm with you about resources. It's not a lot of people. So unless there's a really strong reason not to apply for Medicaid, I really encourage people to apply for Medicaid so that they can establish themselves within the system of the Department of Mental Health. Case management would provide you with the access to someone that knows your background and is there to assist you in finding resources and potentially paying for resources. Now, this is another sticky wicket. People think that, oops, I've got Medicaid. Now I'm going to get through the door, get this case manager, and I'll be eligible for all these services. not the case. So Medicaid is a health insurance plan, and that's Mo Health in Missouri. What you're going to need in order to actually get funded services at the Department of Mental Health is Medicaid waiver. And this gets very complicated. So I'm going to explain it. It's really not that complicated, but there's so many layers. I think it gets confusing for people. So Medicaid waiver is an extension of what Medicaid can do for people with disabilities. So it was put into law. I don't even know when it came into law. It's the Home and Community Based Services waivers, and they are contracts that federal government has with the states that are renewed every 3 years. And the states determine the types of waivers that they want to implement. So we can have waivers that are based on age, like a children's waiver. We can have waivers that are based on diagnosis. We have a very small autism waiver, but primarily waivers are based on dollars, how many dollars you're eligible to have towards the services you need. So there's a Partners in Hope waiver, which is a very small waiver of about $15,000. That is a waiver that is split between the state, the federal government, and your county tax boards. The community-based waiver is the middle waiver. It is a capped waiver, but it caps in the mid-20s to $30,000, and they can actually extend above the cap based on need. Community waivers allow you to get access to services like day programs, behavioral supports, some of the things where your family member is still going to live in the family home, but these resources could provide them with a better quality of life and pursuit towards their goals. And then the waiver is the comprehensive waiver, which is exactly what it says. It's comprehensive. So there's no actual dollar cap on that waiver. It's designed to meet the needs of people that have the most significant need. And those typically are people that are going to move into some type of residential placement. So that can be up to $200,000 a year per person to be able to apply that waiver. So from the family point of view, I guess what I'm hoping you'll get from this is that there's a structure to the way you can access funding, but you have to be creative to know who's going to be the best person to provide the funding for what you need. It's best to be proactive and apply for services and deem eligibility. The earlier, the better. And partially that's because you've got better documentation when your family member is younger. You've got the documentation from the school system. You've got the documentation from the pediatricians. As someone gets older, it becomes more and more difficult to prove that their disability occurred before the age of 22. And it's very frustrating when I meet with somebody who's 60 and we're trying to go back and prove that they have a lifelong disability. So the sooner you can apply, the better. You can have Medicaid and Medicare together, and you can have Medicaid and other insurance together. Medicaid is the insurer of last resort. So if you want to keep your insurance for your family member, you can, and there's no penalty for that. And that Medicaid is the kind of launching point for funding at the federal level. So if you want to know that down the road, your family member is going to need to find their own place to live and will need significant supports there, that it makes sense that you start that Medicaid process so that things are ready, because this can be a process of many years. Once you have Medicaid, to apply for a waiver, at that point, it's needs-based. And so your needs are based against every other person in the state of Missouri. Based on the state's budget, we may increase the number of people that are served annually by 25, 50, 100, or we might not increase it at all. So you could sit on the list and other people could have an urgent need because a family member died or something else, and you could not move up a waiting list during the course of a year or 2 years. So again, we like to advocate with people. We're in that situation. So please know that if you're using this web page, you can go back down and it says, if you need assistance, you can click for a family navigator and it'll tell you about navigation services that are available. It's going to tell you about family navigation and about the agencies that are funded to provide that type of service to you. And we recognize that these are really complicated resources to access. So that's why navigators are available to you and why they're important. So I hope this is helpful and is something that you can use. If you need to reach me, don't hesitate to call the St. Louis ARC at 314-569-2211. And thank you for listening. Bye-bye.